Hello, this is Robert Weinstock, MD, with Caroline Watson, MD, and we're going to be talking about bimanual microsurgical cataract surgery with MST instrumentation. This episode number 3 is on bimanual phacoemulsification with divide and conquer techniques. Let's start by examining the instrumentation. This is the Duet bimanual Nagahara 19-gauge open-ended irrigating chopper with the handpiece, and this is the tip we use routinely. It's got a small little ball at the end of it that we use to manipulate the nucleus and crack the nucleus. It is not very sharp. There are many different types, but this is the one that we prefer, the tip we prefer. And again, it's open-ended and 19 gauge, and it goes through 1.4 to 1.6 millimeter diamond blade that you've seen on previous episodes. This instrument provides great irrigation into the anterior chamber when it's matched up with the right wounds, and that will be in our left-handed.
Through our right-sided wound, we're using this particular MST phaco needle, which goes on our Stellaris Elite phacoemulsification unit. It screws right onto the Stellaris handpiece that is designed for it, and again, it matches our diamond blade incision. It's a straight 19-gauge sleeveless phaco needle with a 30-degree bevel on it, and this is used in all of our cases. This is the little tightening tool to assist us in making sure that that phaco needle is on there securely. Once again, you can see it's the same exact size as the 19-gauge irrigating chopper that we use on the left side. So we have matching instrumentation, matching irrigation to match the outflow. This full sleeve can be put on if you're going to do coaxial phaco, but when we do bimanual, we pinch off the sleeve because we're going to operate through a smaller wound and we're doing sleeveless phaco. Now, the Stellaris, as well as other machines, are programmed to not allow these needles to get hot, which allows us to operate with this bare needle.
So as we get going here, we've already created the wounds in the capsular rhexis, and you can see we're first putting the 19-gauge irrigating instrumentation into the eye through our 1.4 to 1.6 trapezoidal wound, and then our phaco needle. And we go from foot position 1 down to foot position 3 as we provide irrigation anteriorly in the anterior chamber, while our phaco needle works deeper inside the nucleus and down inside the capsular bag until it's deep enough of a groove that we can crack it, and then we go ahead and make a additional groove. It's a very basic, simple, easy to use daily technique, and chopping it into basically 3 pieces now. Now, instead of spinning it around and doing it into 4 quadrants, we'll just go upsetting and grab these first 2 quadrants, and with a higher phaco and vacuum setting, we will remove these quadrants. Notice how quickly they come to the tip, and also notice how the irrigation piece is kept anteriorly, and it pushes the iris back and creates a very stable chamber. Sometimes when there's an epinuclear shell, you can try to grab it. If not, then you can just let that be and come back with INA to remove the cortex. So here's just another case of an eye that's been treated with a femtosecond laser and pre-chopped. You've got an irrigating chopper through the left wound, staying stable anteriorly, keeping the anterior chamber well maintained, and left hand is kept still. A couple grooves, rotation, cracking of the nucleus, again sculpting the nucleus. So we cut it into that particular hemisphere. We'll cut it into 2 different quadrants right there for ease of removal. We'll go up to a higher vacuum setting where we can grab that quadrant, pull it up. Here's where we engage the left hand sometimes to chop the nucleus into smaller pieces, or just to manipulate it, depending on the size and how cooperative the quadrant is in the piece of nucleus. Here we're going to chop, again grab, use the second instrument mostly in the anterior chamber to maintain the space, keep the iris back. And this is how we handle the floppy iris cases and complex cases. And it's quite impressive how that anterior chamber maintainer capability of the irrigating chopper creates such a stable and deep eye that you can work very efficiently and quickly with high vacuum. So the instruments that you've seen are the curved Duet bimanual aspiration handpiece, as well as the phaco needle. And this concludes our segment on bimanual phacoemulsification.